Are you struggling with low energy, unwanted weight gain, constipation, dry skin, hair loss, maybe fertility problems? If so, you may have a thyroid problem. And we're going to explain exactly what that is and what you can do about it naturally. So I just want to briefly go over what the thyroid does in your body, the function of the thyroid. And it's a gland that produces a hormone that has many important functions. I just want to tell you where it is because not everybody knows. It's right here under your Adam's apple. It's a butterfly-shaped gland. And it produces hormones that most people know of as T3 and T4. And the thyroid plays a huge role in your metabolism, so which it greatly affects your ability to lose weight. If your thyroid is under functioning, it may be very difficult for you to lose weight, or it may be very easy for you to actually gain weight. If your thyroid is over functioning, what's known as hyperthyroid, you may not be able to gain weight. You might be losing weight without wanting to. The thyroid also impacts the quality and texture of your hair. So it can cause dry, thin hair, brittle hair that breaks easily. And some people with very severe low thyroid function actually lose the outer third of their eyebrow. So it affects their eyebrow hair as well. It also plays an extremely important role in your energy levels. So an unhappy thyroid, an underfunctioning thyroid will cause you to feel sluggish and low energy. If it's hyperthyroid, you will feel not that you'll have more energy, but you might feel agitated. It also regulates most of the other hormones in your body. So estrogen, progesterone, cortisol, testosterone, all of these important hormones that need your thyroid to function properly for them to actually function properly. And that's why it's involved in fertility. So if you don't have normal thyroid function, you're not going to be producing your sex hormones normally. And that affects both men and women. Your mood is also impacted by your thyroid. Underactive thyroid can lead to feelings of depression, and overactive thyroid can cause feelings of anxiety. It impacts your ability to concentrate and focus. So you may have brain fog, you may suffer from memory issues as a symptom of dysfunctional thyroid. And your body temperature is also in part regulated by your thyroid. So if your thyroid is underactive, you may feel cold all the time. And if it's overactive, you could have an intolerance to heat. And it also regulates your heartbeat. So a low thyroid function can cause a slower heartbeat, an abnormally slow heartbeat, and a hyperthyroid can cause what's called tachycardia, or a racing heart. That's actually the most common symptom that people come in and complain about before they even know that their thyroid's involved. They'll complain that their heart is racing. So the types of conditions that you could be diagnosed with by conventional medicine. So we mentioned underfunctioning and overfunctioning thyroid, hypothyroidism or hyperthyroidism. Hypo, you're not producing enough hormone. And the question is, why aren't you producing enough hormone? And hyperthyroid, which is overproducing it. And the same question, why? Why is that happening, right? So with conventional medicine, if you're hypo, they'll give you a synthetic, usually a synthetic thyroid hormone to, let's say, compensate for the fact that your thyroid's not making it. And if you're hyperthyroid, they can give you a different kind of drug, methimazole, or they might cause irradiate it with radioactive iodine and just shut it down altogether. These are not really good solutions because they don't identify and address the underlying causes of the problems. So some of the causes, or one of the main causes of hypothyroidism that we see is an autoimmune disease known as Hashimoto's thyroiditis, and thyroiditis means inflammation of the thyroid. So that's when your body is making antibodies and it's attacking the thyroid. But we're still left with the same question. Why does that happen? Why is your body destroying the thyroid? And with a hyperthyroid, it's often an autoimmune disease called Graves' disease. But either way, it still doesn't tell us what's happening. Why is it happening? And how do we stop it? And then another common finding with thyroid is thyroid nodules. So these can be found, these little growths can be found on your thyroid, whether it's normal, your hormone levels are normal, or hyper or hypo. So very often these little nodules are benign, meaning they're not causing any problem, but medical doctors like to biopsy them to make sure. And I'll tell you what, one of the things we find, and not just with the thyroid, but any kind of biopsy, is that if you biopsy something over and over again, it eventually starts to develop problems, inflammation, right? You keep going in there and cutting away at an organ, it has an inflammatory response. So not really recommended. And then the other thing that we see more frequently these days is thyroid cancer. But there's some recent research that says that thyroid cancer is not a true cancer. It's usually a very slow moving cancer. So it doesn't need the same type of conventional treatment. I mean, when I first went into this field, if you were diagnosed or suspected to have thyroid cancer, they just take your thyroid out. I saw a lot of patients have thyroid removed, and then when they actually take it out and do a full biopsy, they find there's nothing wrong with it. But the old adage with conventional surgery, when in doubt, take it out. So we don't know what's going on, so let's just remove it. You don't need it. But it's really hard to stay healthy without a thyroid in your body. So let's actually talk about the causes of these thyroid conditions. And from my viewpoint, what I see in my practice is the number one cause of thyroid dysfunction is exposure to chemicals that end in IDE or INE. So I call it the ides and the ines. So things like fluoride, found in toothpaste and drinking water, chlorine found in all kinds of things, bleach flour, bleach sugar, cleaning products, swimming pools, and then bromine, which is a chemical that's added to wheat in the United States, and it's also added to some municipal drinking waters. So why do these ides and ene chemicals mess with the thyroid so much? And that is because the thyroid cannot make its hormone without iodine, which ends in INE. So there are so many people that are iodine deficient. And especially when you're iodine deficient, these chemicals, these ides and enes, molecularly look similar to iodine. So your thyroid will just grab onto them, desperately needing iodine, right? And these chemicals are toxic and cause an inflammatory response in your thyroid, which destroys cells, and that can set off an autoimmune response, whether that's a hyper or hypo response. So obviously the first line of defense is avoiding these types of chemicals, and also possibly doing a detox if you've had exposure and you're having thyroid issues. The other most common cause of thyroid dysfunction is exposure to hormone disruptive chemicals. So I'm going to give you some examples of that. BPA, which is found in plastics. So microwaving in plastic, drinking out of plastic water bottles, especially when they have been exposed to heat. Baby bottles often have BPA. Canned foods are often lined with BPA. Believe it or not, paper receipts, right? So when you go to the store and get a receipt, they're very often contaminated with BPA. So if you're going to use plastic, make sure that it is BPA free, avoid touching receipts. And, you know, it's just better if you don't microwave, period. Just microwaving is not really good for you. It does destroy the nutrients in your food. Some other substances that may be found in personal care products, so cosmetics and lotions and shampoos and, you know, anything that you put on your body, and also feminine hygiene products, perfumes, things called phthalates, parabens, triclosan found in hand sanitizer. So that's why it's important to try to use really clean products as much as you can. Read labels. And if you're unsure, go on the Environmental Working Group website, and I'll put a link in the description, ewg.org. And on that website, you can see any product and how toxic it is. And think about products that you're putting on your neck, right? Any kind of, you know, lotion or perfume that you're putting like right here, right on top of your thyroid. There's direct damage that you're causing. Another common source of thyroid damage is the electromagnetic fields that you're being exposed to. Your thyroid is very sensitive to radiation. So think about if you're, you know, you're holding a phone on your ear and it's right here next to your thyroid. So a phone is a major source of continuous exposure to electromagnetic fields. And of course, you have other exposures all the time from your, you know, cell phone towers that might be near you, your device, your other devices, laptops, even the Apple Watch, Fitbits, you know, anything that especially things that you're putting on your body that emit this type of frequency can cause damage. So you need to be more cognizant of that. Try to keep those things away from your body as much as you can control it. What's very interesting is that iodine has a radiation protective effect. So to some degree, iodine protects you from radiation. That's interesting. So if you have a iodine deficiency and you have a lot of exposure to dirty electromagnetic fields, you're going to be much more likely to end up with thyroid issues. And then the last source of possible irritation to your thyroid that I want to mention, something a little strange, but certain vegetables that have a high level of what's called oxalic acid, or also known as oxalates. So oxalates can be damaging to the thyroid. They can also cause kidney stones. And they're very high in some vegetables that a lot of people use for juicing. All right, so kale and beets and spinach, Swiss chard. So those vegetables are good for you, but you need to cook them in order to reduce the oxalic acid, right? So I'm not saying you should never have them raw, but especially if you have thyroid issues, you shouldn't be having them, you know, high doses of them raw and juicing them every single day, right? So go easy on those vegetables, and you can actually look up vegetables or even some fruits high in oxalic acid, and make sure you're not overindulging in them. So I'm going to talk to you about some solutions, but just before I do that, I want to give a shout out to my partner in truth, HAT's Hardcore Awakened Truth Seekers, which is the most informative truth movement out there. So please check them out. Join this wonderful organization to gain valuable information and be a part of a real community. They have an online store with some very nice items. This is my HAT's truth mug. Everything tastes better when you drink it out of that mug. I love that mug. And then I have all of my t-shirts from them. I'm wearing this one today. And they just came out with a new item, a yoga mat. So if you do yoga or you need a mat to exercise on, please go ahead and check them out and support them. I will put all their links on the description of this video. So talking about solutions for your thyroid, number one, you do need to have a source of good quality iodine. So I like iodine derived from kelp because, as you know, the supplements that I use are always made out of food, and kelp is a great natural source of iodine. Iodine is very controversial. There are some doctors that will tell you it's dangerous, don't ever take iodine, and other docs that will tell you, oh, you need like a zillion milligrams of iodine to be healthy. So you do need iodine. Many cells in your body need iodine. It's not just your thyroid, your brain, your salivary glands, your digestive tract, your eyes, your breast tissue, your ovaries, all need iodine. And your thyroid cannot produce thyroid hormone without iodine. So we use what we call low dosing iodine. I don't mega dose. And because iodine can also have a detox effect, if you're very toxic, you have to start slowly. So I'm just going to show you my favorite one from my favorite company, Standard Process. This is called Iodamere. So it's a pretty low dose of iodine. It's 200 micrograms in one tablet. And most of my patients only need 1 or 2. And we do have, Standard Process does make higher doses of iodine products as well. That's the one I think I put most people on. And by the way, I would recommend that you don't just go on my website and start ordering products for your thyroid. If you think you have a thyroid issue, let me either help you with it or refer you to somebody in your area that can help you with it. Okay. It can be delicate, you know. I don't recommend trying to do it yourself. The next thing that's really important for your thyroid is selenium. Selenium is a trace mineral. And again, your thyroid needs it to make thyroid hormone. And another mineral that's needed is iron. So most people don't know that. So those 3 minerals, iodine, selenium, and iron, are critically important for your thyroid to be able to make thyroid hormone. So if you have iron deficiency anemia, it's going to actually end up affecting your thyroid. And selenium, by the way, is also important for your immune system. So of course, all minerals play multiple roles in your body. One of the things I like to do is put people on a really good trace mineral supplement. So this is one of my new favorite trace minerals. It's from a different company. It's not from Standard Process. It's from a company called Cellcore. It's called CT Minerals, and it has 60 plant-derived minerals in it. So it's a soil-based trace mineral product. And it's kind of like a good multi-mineral like basic product that I put a lot of people on. And then just for supporting, let's say, an underactive thyroid, I use this a lot. Again, it's not from my favorite company, Standard Process. It's from Dr. Fit. It's called OMG Spark Plug. So this really is great for underactive thyroids. It works very quickly, and it's a bovine based thyroid product. So it's kind of like a thyroid tissue supplement. And then the other one that I use a lot is this. This is from Standard Process. It's called Vitrophone Pmg. So this is great when you have an autoimmune condition, because any of the Standard Process products that have the letters PMG on it help with autoimmune issues. All right. And actually talked about that in another video. I have a video on autoimmune issues, which I'll put a link to in the description. So if you do have an autoimmune issue, you can watch that one. And also my video on, are your supplements worth your money? And we talk about how those kind of things work. And then lastly, for somebody with hyperthyroidism, I usually use an herb called bugleweed. Bugleweed works beautifully to correct an overactive thyroid. Again, I wouldn't mess with this on your own. If you're struggling with any of these things, let's get you some individualized help with that. But with the bugleweed, it actually works really quickly. And then after a while, the person doesn't need it anymore because the thyroid starts to behave normally. So that's it for now. I hope this was very helpful. If you like the video, please hit the like button. It helps more people to find it. Don't forget to share this with anybody that you think might need to hear it. And then if you haven't had a chance to subscribe yet, just hit the subscribe button now. I would greatly appreciate you as my subscribers, and I look forward to seeing you again soon.